Thank you so much and welcome everyone. This is definitely a topic that I'm very passionate about. I think in the past 15 years and more so even now, we're seeing more and more iliopsoas injuries in our canine clients. And there are a lot of things when we're looking at them to get them back to that 100%. It is probably one of the more frustrating injuries that we see in the clinic just because it requires so much patience, not only by the practitioner, but also by the owner. And these often are the owners that will ask you, how soon can my dog get back to playing fetch or agility or fly ball and that sort of stuff? And many times, the dog is just starting to get better and they try to push it, and the dog will, take some steps back because they thought, oh, it's a beautiful day. It's spring outside. Let's go outside and throw a little ball or, that sort of stuff. So it definitely is, can be a frustrating injury. And so when we look at the work of the iliopsoas, and this huge Leon Berger is one of my clients, and his owner is a photographer, and I just love this shot. And as this guy is going for his ball, what is about to happen is his legs are going to land, and the iliopsoas, both components, which I'll talk about in a moment, are going to work to help slow him down. So they're going to work eccentrically to slow that body down. And we see this type of movement in dogs that jump off a couch, that are involved in agility, that are chasing squirrels, that are catching a ball, that are retrieving in the field. So it's a very common movement. Some dogs are definitely doing it more than others, but we can definitely see iliopsoas injuries in both working dogs and your stationary dogs, as well as a secondary or tertiary issue related to hip dysplasia, cruciate disease, and even lumbosacral issues. So iliopsoas injuries and soft tissue injuries, they're often problems we may not be seeing. And I say seeing because commonly if a dog pulls up lame, the first thing we're rightfully going to check for is radiographically if everything is okay. So radiographs are taken, everything looks good. And, very often I hear from clients, they were told just to rest the dog for 2 weeks, go on an NSAID, and then see what happens. Well, soft tissue injuries, we're not going to be able to see them radiographically. It's going to take a little bit more diagnostics to see. But very often we could see the injury, meaning see the lameness, and we could feel. So we can utilize our hands to determine if there's soft tissue restrictions, if there's pain, if there's inflammation. And this can always be followed up with diagnostic ultrasound and other tools. But we certainly see these injuries in performance and active dogs. Frisbee or disc dog is one of the more common areas, lots of protection work. So as I said, these soft tissue injuries are increasingly common in working in athletic dogs. And the more we're seeing the dogs worked, if there's not a proper warm up or cool down or proper core strength. In some canine sports, we see dogs able to start competing as young as 15 months of age. And we know that they're practicing way earlier than that. So the dogs may not have the body awareness, the core strength, all of that sort of stuff that's needed. And acute stretching-induced muscular injuries are estimated to account for over 30% of injuries seen in a typical human sports med practice. So we can ask ourselves, can we meet those numbers in vet medicine, or do we see that many? So In the rehab clinic that I'm in, we see a lot of soft tissue injuries, but everything else has usually been ruled out by then. And when we look at the iliopsoas, so it originates at L2 through L7, and this is such a huge component to talk about, and I'm going to keep coming back to that lumbar component, because very often I find that practitioners are missing that lumbar component. It inserts into the lesser trochanter on the femur. And as I mentioned, a huge mistake is not treating that lumbar component. If we're treating with whatever tool, if you're lasering, if you're doing massage, if you're doing pulse shock wave therapy, if you're using the Assisi loop, we need to treat both components. So the origin and the insertion, so important to get that dog back to 100%. And we look at the action of the muscle, so the hip component, as the muscle inserts into the hip, it acts as a strong hip flexor and hip external rotator. This is why when we stretch that dog into extension and add a little bit of internal rotation, we may see restrictions. Very common with an iliopsoas issue is seeing that restriction. The lumbar component acts as a pelvic and lumbar stabilizer. So your take home from that little phrase right there, the pelvic and lumbar stabilizer, is that these dogs need core strength. So we need their core strength as strong as possible. If you work with performance and working dogs, getting them on a strong core program to help prevent these injuries is important. In the lumbar area, if the muscle is restricted or tight, it causes a pull on the lumbar and the pelvic spine into extension or arched position. We may also see a lot of these cases that go on and on and on. If, for example, the right side, the right iliopsoas is injured, you may actually start to see a bit of a side flexion of the lumbar spine because the area is becoming so restricted. And if we don't start working with that and straightening out the spine with lots of means, you're going to have an issue. That dog, again, is not going to get back 100%. When we look at the combination, when the hip flexes, the lumbar spine should remain in a neutral position. When the hip extends and the iliopsoas is elongated, the lumbar spine should remain in neutral. So we shouldn't see a lot of this flexion and extension. And again, another really strong plug for core strength. And I'll go through some of that too, but as a preventative measure, as well as working to get these dogs back to normal and back to 100%. So when we look at the prevention of or presentation of the iliopsoas, I'm so excited about preventing them. The presentation of iliopsoas issues, we're definitely going to look at the history, the clinical signs, the dog's gait, palpation, and function. And again, putting it all together, all the pieces of the puzzle together to find out when this happened and exactly what is going on. So when we palpate the region, I always caution practitioners to be cautious with this. This is my own dog. He has right canine hip dysplasia and has iliopsoas pain very frequently due to this. And if we just watch this video, so I'm coming in and palpating, and I always, especially the first time doing this, I have someone holding the dog's head. It's a light palpation. You can see his reaction. He does not like that. So be very careful. I very often come in bilaterally and will palpate one side then the other side. But a dog that has issues with hip dysplasia, lumbosacral disease, I mentioned cruciate disease, they could be very restricted in this area. And when you're palpating the iliopsoas, you are going to, I like to find the rectus femoris, move in medially, then move up dorsally, and you'll feel this band. When you flex the hip, you should feel that area soften. When you extend the hip, you should feel the area tighten. So in a dog this size, the iliopsoas is going to be about the thickness of your thumb. So here is, if you look at the picture on the right, this was a border collie in the show ring, and we can see how she was presenting. If you look at that left hind limb, pretty turned out there. And this dog had, not only is she active in conformation, but she's also active in herding. And 2 days prior, she had slipped in the mud while herding, then got all pretty for her conformation show. And if we look at her video, we can pay attention to that left side, and we can see how she's sort of hopping along. She's not extending that hip very well, not putting all the weight onto that left hind limb. And this is a pretty athletic dog. We'll show it to you again so you can take a look at that. You can see that little hippity hop there. And so she presented with an iliopsoas issue. And of course, when she was in the show ring, she actually got dismissed for lameness by the judge, which I was glad to see. Sometimes you don't always see that. So some more of the history, we may see that the dogs have a decreased performance. They may be slipping because their weight is not on that leg all the way. In dog sports that have jumps, such as agility or fly ball, they may be knocking bars because they can't extend their hips to clear. In agility, you may see them that they pop out of weave poles. And a couple things could happen is that the dogs maybe refuse to enter the weave poles, or they pop out because that side to side movement is requiring so much of this iliopsoas area that they can't handle it. The dogs may avoid slippery floors, decrease jumping ability, and decrease jumping and strengthening, so they just don't have the strength. And if you look closely at this German Shepherd, he is not placing all of his weight on that left hind limb, so he's shifting more of the weight. This is a working state police dog in our state, and up until a few years ago, they would play a lot of fetch with the dogs to kind of take the edge off. Through education, they've been doing things a little bit differently. So you can imagine the dogs come out of the car, they're not warmed up, and their ball or their Kong is thrown repeatedly, and it's a kind of a setup for an iliopsoas injury to occur. So some of the clinical signs that you'll see, certainly pain with stretching of the hip into extension and a little bit of internal rotation. In your acute cases, you may not even get to internally rotate. You may just try to extend a little bit, and that's it. If the dog is super painful and they can't even extend actively, I'm not going to try to extend passively. And some examples of active hip extension would be just putting their front legs or their forelimbs up on a step. Can they do that comfortably? So, are they stretching on their own? Are they moving well on their own? Also, pain with stretching of the hip into abduction. Again, the dog is guarding their pelvic area, so they're not going to want to bring that hip into abduction or have it brought in on their own. Same thing with watching them move. Can the dog do a figure 8? If they can't do a figure 8 well, is it because they don't have that motion there? Pain and spasms in the groin region and the lumbar region. So these spasms could be pretty intense, enough where the dog will have difficulty urinating or defecating in the acute phase, or in a more subacute or chronic phase, it may be a little bit more subtle there with the pain and the spasms, only to palpation or with activity and palpation. Also, because of that lumbar component, may see that lumbar pain as well. So we want to look at their gait and posture also. I'm just going to move me down here a little bit. So we'll see that decreased extension. So while the dog is gaiting, we'll see that they have less push off or less extension there. And if you have a gait analysis system, great. If not, you can look at this and determine if they're extending or not extending as much. They may also have a circumducting gait, or they're going to swing that leg out. So for example, if their right hind limb was suffering from an iliopsoas injury, instead of advancing it forward, they're going to circle that limb out. And that's avoiding using those hip flexors. Decreased power pushing off. So the dogs may not be able to jump in the car, jump on the couch, jump on the bed, run upstairs as normally they would. So things to look out for. If this worsens or it's in the acute phase, they may be non-weight bearing or partial weight bearing. And as we saw with that German Shepherd, it looks like the dog is fully weight bearing, but they're really not. So with that leg turned out. I also always look at the sitting position, because getting into a tight flexed position of the hip may be very difficult. So if you look at this dog, again, focus on that right side. The right side is just coming out a little bit, and I call it a butterfly sit. So they may not be able to flex the hip as tight and adduct. So they kind of sit in a butterfly position. Other areas to consider, certainly not everything will be iliopsoas. As I mentioned, it could be a primary, a secondary, or tertiary issue. Stifle disease, very often the iliopsoas is going to compensate for the stifle disease. So we may get that where the whole iliopsoas complex is restricted. Canine hip dysplasia. So we have that loose hip, right, from the hip dysplasia. So the surrounding musculature is going to lock down, very similar to what's going on with my own dog. A lumbar transitional vertebrae. So here, the one, it's most likely or most usually unilateral. We will see that there is a change in biomechanics. So the iliopsoas is going to be shortened or restricted on the side of the lumbar transitional vertebrae. You can also see it in lumbosacral stenosis. And this image is digital thermal imaging. And these tools are wonderful to look at the body temperature. This dog is a working dog, and we could see that the red is representing heat or an increase in temperature, that the right side is pretty warm and all along the right side, so he's been compensating. This dog had a chronic iliopsoas injury, and this was how he presented on the first day. So not only was that hip flexor area very painful, but so was the lumbar region. Bilaterally, but definitely more on that right side. As the practitioner, so I always say it's up to you to decide if the iliopsoas is the primary problem or compensatory. I see many iliopsoas issues that are diagnosed, they come in and really they're a cruciate tear. So important to take a look at and make sure you're identifying the lesion. That's always the key to successfully treating the animal, is to identify the lesion, target the lesion, and treat it. So, certainly if you have an iliopsoas injury that you've been spending a lot of time with and they're not getting any better, are you looking for something else there? My rule of thumb is I want to see a significant improvement in 3 visits. Definitely, hopefully by the first one, but definitely by the third one. If not, is there something else going on there? And this is assuming that all your radiographs are clear. There's nothing sitting there in the area. So making sure, again, we're treating the entire dog. So in the acute presentation, this whippet, this was racing and pulled up lame. And you could see, again, if you focus on that right hind limb, how much she's rotating off. She's getting that weight off, and we can see that curvature of the spine because she's really pulling all the weight off the right hind limb onto the left. So as I mentioned, the dog may be non-weight bearing or partial weight bearing. It just depends. This dog to the owner, to some owners, may look like they are fully weight bearing, but in actuality, they're not. There's severe to moderate pain at the musculotendinous unit, muscle spasms. We're going to see that decreased active and passive hip extension with internal rotation. And I always like to look at active first. Active range of motion will present the dog's willingness to move. So can this dog even put their front legs up on something? You know, many owners have SUVs. The dog needs to jump in the car, or, you know, and a common way is to put their front legs up first. Will they do that? The lumbar region is going to be painful as well, again, from the origin of the muscle. So our goal of the treatment and the multimodal approach, we're always going to follow this multimodal approach. So I tell this to my staff all of the time. We need to identify the lesion. Where is the pain? And this is your rehabilitation lesion. So what is going on? You don't want to mindlessly ever laser, shockwave, massage, or anything like that without exactly knowing where the problem is. And we follow the multimodal approach. We reduce pain and inflammation. So if we don't do that, we are never going to restore movement and strength. So we reduce the pain and inflammation, and there's so many tools to do that. Whatever tool works best for you, fantastic. You may also find that some dogs do better with one tool over another, but however you're going to do that, and certainly pharmaceutically, whatever you can do to reduce that pain and inflammation. And this is something that it's so important for the owners to understand too. I have many owners, and I'm sure you do too, that don't want their dogs on NSAIDs or anything like that. And I really strongly enforce in the initial phases, we want as much on board as we can to get that dog out of pain. So we're going to restore movement, and this joint mobilization, which I'll get into, we want to focus on the lumbar component and the hip component. And then we'll work on passive range of motion, so getting that motion back. Then we're always going to follow it up with active range of motion. So for example, if I've increased hip extension passively, I want to improve it actively, either with cavalettis, walking in the underwater treadmill with maybe just a little bit of water to start, so the dog has to pick up and flex that hip, or extend the hip rather. And then think about what you're going to send that dog home with. So what is going to be their home exercise program? That will be so key. So, and then the last component is going to be that eccentric activity. So if we remember that Leon Berger, as he was about to jump on his ball in the snow, that is the last component, the last thing that we work on. So this was a dog that just came in not too long ago, Biscuit, and he is a 5-year-old intact male whippet with an acute history of left hind limb lameness. And the owner related that it began after an oval race event. And the reason I mentioned an oval race event, for those of you that are in the United States, all of our race tracks go counterclockwise. So the left side is going to be on the inside. In most other countries, and feel free to correct me, the dogs will race in both directions. So to get him back, to understand that that left leg is going to be on the inside. Right away, she noticed that he was reluctant to jump into the van, play with the other dogs, and defecate without moving. And as funny as that sounds, it's always a question I ask: does your dog poop and move? And of course, if they were a pooper and mover before anything happened, that's a different story. But if they cannot hold a defecating position and they're moving, that's telling me that they're in pain in that position. And it may not necessarily be an iliopsoas issue. It may be lumbosacral, hip dysplasia, or just generalized weakness. So Biscuit was placed on Robaxin and NSAIDs and came in to see me. And we can look at just how the left leg is positioned differently than the right leg. The calluses over the ischial tuberosities have been there. I forget what she had said, but they had been there for about 2 or 3 years, so that's unrelated to this going on. But if we just look at how that left hip is being held in a flexed position, and the lumbar spine is also flexed. And just a quick video as I'm in there palpating and looking at the ilium and the slight rotation forward. And then as we're palpating and seeing those muscle spasms there. And I'll play that again because it's bilateral, but you can see it more on that left side. Unfortunately, it's always easy to see things on the whippets and the greyhounds. So upon clinical presentation, he had repeated pain to the left iliopsoas, also pain upon palpation to the left lumbar region. He had decreased left hip extension. The left hip was 150 degrees, the right was 160. Not huge, but enough to make a difference. Decrease in thigh muscle mass by 2 centimeters on the left compared to the right. And when we did a dynamic gait analysis, he had decreased extension on the left hind limb at 48 centimeters compared to the right at 56 centimeters. So I'm always looking at the stride length, the step length, and comparing and taking a look at that. And this is for those of you that have a gait analysis system, I always want that head held in a neutral position. Our treatment goals: decrease the pain and inflammation, looking at treating the origin and the insertion of the iliopsoas, improving his range of motion, so working on hip extension and lumbar extension. Because he's a sight hound, we are not going to look for a flat level top line. We need to make sure we'll get back to his normal, which is that slightly arched top line. We want to improve his strength, begin eccentric strength, and return to previous levels of activities. And for this owner and the dog, it includes oval racing, as well as playing out in the backyard with the other whippets that live in his house. So we began with pulse shockwave therapy. This is using a linear head with a piezo wave 2. And our goal is to decrease the lumbar pain and the sensitivity. So I'm just treating over the area and moving along on that left side. And I'm getting a little bit of central, certainly. So just play that video again. So I like to begin up in the lumbar region. A lot of times this will help relax the dog. And then I can get up and under that iliopsoas region. So here, just going in, I'm going into that insertion. I'm going to be treating that area, as well as hitting a little bit of the rectus femoris. And the linear probe, this is wonderful to work with. I get more surface area, and I just absolutely love this with the iliopsoas cases, as well as the hips and the spinal. So I'm just working in there. And you can see that this is not causing him any discomfort. He's doing well with this. And again, just making sure I'm getting into that medial area. That linear probe helps a great deal. And then joint mobilization. So I'm working on mobilizing the left ilium in a dorsal to ventral glides. And in this, my thumb is going to locate the area. And then it should be thenar eminence, that was my fault, is just going to apply a dorsal to ventral glide here. And I'm going at the rate of about 25 to 30 glides per minute for up to 3 minutes. It's giving me a little bit of a look. Do another video. But I find this very effective in turning off those muscle spasms. So, just working on that and, paying attention. I like this position because I'm able to, if he doesn't like it, I just take my hands off. But I'm, again, up to a couple minutes for this, and it's just going to turn off those muscle spasms. And then I'm also going to work on the lumbar motion. So remember we have the origin from L2 through L7. He was pretty restricted L4 through L7, with the left side more restricted. So I'm going to start with some dorsal, central dorsal to ventral mobilizations, and then also factor in those facet joints and things like that. And joint mobilization is a whole nother topic, for things. But just getting a look, the left hand is underneath his abdomen. So if there's any pain or discomfort, and you can see my right thumb is just giving some gentle mobilizations. Again, about 25 to 30 per minute. And I'm feeling, these are graded mobilizations, and I'm feeling for any resistance, anything like that. My initial goal is to decrease pain and then start to improve range of motion. And then we're going to work with some passive motion. So passive range of motion, because now I've gotten the spasms reduced, hopefully reduced pain. My joint mobilization has gotten some more range of motion, and now I'm working on getting that passive motion. I'm going to follow it up with active motion. So I'm just cupping that hip and I'm extending back. I'm going to hold for 10 to 15 seconds and relax when he's had enough. I may repeat this anywhere from 5 to 10 times. And then the key is going to be follow it up with that active hip extension and lumbar extension. So front paws up, walking over cavalettis, sit to stands. And I'm always going to send the owner home with a couple of these exercises. So I want them to follow through at home to make sure that exercise stays. So always important to have a game plan. Biscuit, a dog like this, I'm going to see twice a week initially. And we can see this is the after, bringing him out. He's already standing better. So, this is great that the treatment worked. I will typically do a repeat gait analysis on the dog before they leave the clinic, just so I can see how we made improvement, how does he feel? Certainly pulse shockwave therapy may make them a little bit sore, so we need to be careful with that. I want him to go home and not create rest, just rest, no chasing bunnies in the backyard or anything like that. Home exercise program, as I mentioned, passive range of motion, if the owner can do it. If not, we'll just stick with active range of motion. Specific exercises. The CC loop, this is, especially if they're only coming in twice a week, or some owners can come in once a week, it's just super important for them to do at home. And this is a position that I'll utilize to target the hip component, and then we'll also place it on their lumbar spine. So I have them follow the treatment protocols, typically utilize the loop twice a day on the 2 areas for the first week, and then move to once a week on both areas. And here, just again, if you can't get the loop through the leg, this is fine. Having the owner sit with the dog and have it like that. This is where I found the CC loop has been just such a wonderful blessing, especially with the pandemic, and owners wanting to do more with their dogs at home. So I mentioned the joint mobilization, and this is going to help restore that passive movement, and this is critical. So we really want to get that passive motion there, and then that active motion. And we want to work both on the hip and the lumbar region. And as I mentioned, joint mobilization it takes practitioners, physical therapists, years to perfect this. And there's a program at the University of Tennessee, the certified canine manual therapy program if anyone is interested in more information. I like to put the dog in a functional position when I'm treating. And by that, I mean forelimbs up. So forelimbs up if you're using photobiomodulation, if you're doing massage, if you're doing anything like that. This is great to add a stretch, get them in that functional position, as well as really target the tissue. So for example, I am using photobiomodulation on this dog while they're on an unstable surface, and it's really opening up that hip area, just so nicely that I'm able to get in there and I'm getting that extension there. And so we're stretching at the same time. So think about when you're using your tools, how can you position the dog in the best position possible? So active work and home exercise program. So after all your modalities and the manual work have been performed, we want to follow up with the active motion and then a home exercise program. So, here this dog we're stretching into lumbar extension as well as hip extension, and we're getting some core strength. So remember I had said about that important core, to really work that in a variety of positions, utilizing a lot of different tools. So when we look at core work, and as I mentioned, core work needs to be performed. We have a very busy clinic at Wizard of Paws. I will tell you, every dog that comes in, whether they're 8 weeks of age or we have a slew of older dogs right now, 16, 17, 18, they are all getting core work to some degree. So it's so important. And there's a link on the bottom just about an article about how important core work is. And when we look at the iliopsoas and the position, we can see the relationship of the muscle to the spine and the axial skeleton really makes core work just so important. And the core work is going to emphasize that spinal and hind limb strength. So here are just some examples of core work, forelimbs up, and we're on 2 unstable surfaces. So I can begin with something like this. The owners can do something similar at home and work with this, and just adding that little bit of extension. We're extending the spine, extending that hip, and then we're going to make it a little bit more difficult. And I'll just have the dog lean forward a little bit, and that will start to get that eccentric component working. So by leaning forward and controlling, the dog is getting some nice motion there. So important to take a look at. And so we can look at that. Okay, and some other ways there of, so using a wobble board, forelimbs up and hind limbs down. Anything unstable at home is great. Often I will encourage owners, sofa cushions, dog beds, that all works fantastic. And we always want to keep the level top line, so that flat and level top line. And then with the German Shepherd, just making it a little bit more difficult. So we have a lot of varying degrees of instability here. And he's a working shepherd involved in Schutzhund. And this was at the end of his iliopsoas recovery, and he still comes in once a week to work on his maintained core strength and endurance, all good there. Here's some other variations. So this way, if we look, where the position is a little bit different, but we still have the dog's hips up into extension, and we're working that core. So here, we're just having the dog lean forward. And you notice that left side is a little bit more difficult, and then with the right side. So this is a really tough exercise. And again, it's working that eccentric control. If we watch her top line and how much it's working. So putting it, working up there. And this is very tiring for the dogs. So we don't want to overdo it. Typically with eccentric work, I'm going to do this every other day or every third day to start, and then slowly start building up. And I don't like to give a 3 sets of 10 or anything like that. It's up to the dog's endurance or their capacity. Sitting on an unstable surface or a disc is something also very important to work on core strength. This is at the police academy. We go over a lot of things for the police dogs. So just sitting on that unstable surface is going to engage those large muscles of the hip as well as the pelvic stabilizers. And this is something owners can do at home while they're making dinner. I have this disc set up, and while my dogs wait patiently for dinner, they have to sit on the disc and wait. So it gives me a little cheat way of getting my dogs' exercises in. So sitting core strength, as I mentioned, just as important. And this dog is just sitting on another unstable surface. And I look for that tight hip control. If we start to see the hips start to butterfly out, then the dog's getting tired and we'll take a break. And I would much rather work at the dog's ability than, again, give any owner 3 sets of 10 or do it for 10 seconds. So I really try to educate owners in quality over quantity. So as soon as this dog starts to butterfly their hips, we're going to take a break and may repeat it, a few times.
Good boy, look at you. Good boy.
So we can see him sitting there.
Rocco
is annoying. Sorry about that. So Rocco is a high-level field trial dog, and we are working on preventing any iliopsoas injuries. His owner knows enough Labradors in the training community that have been injured. So his goal is to prevent it, which is always nice to hear that. Walking on unstable surfaces is a fantastic way to continue to work on the dog's balance and help with proprioception and more core strength. And if anyone lives near floating docks, or sometimes the playgrounds have swings that are fantastic. I have a 9-year-old Bouvier I'm working with, and the weather just got nice, and his owner's been taking him out, and he stands on the stand-up paddleboard while she goes out, which is lovely. But walking on an unstable surface is great. This is a floating dock, and it helps work that body awareness as well as give a little bit of core strength and all of that sort of stuff. You can incorporate sit to stands, weight shifts, figure eights on this, all fantastic to do and fun too. This is always a fun adventure to give owners. Of course, if you don't have any floating docks near you, you have to get a little bit more creative. So I mentioned the eccentric strength, and this is going to be the last component. So as we're returning that dog, we think about that slowing down motion. And this is often the culprit to re-injury. So the dog goes and runs and chases a squirrel, or they are playing in the house, or they're doing something like that. And then we start to have, issues. So just working again, in this position, the dog's hind end is a little bit higher, and you can use peanut butter, anything that'll work to have the dog lean forward. And we're watching the quality of the stance on both those legs. And again, I'm just going to repeat this. So as the dog is leaning forward, we're getting that contraction of the iliopsoas as it prevents the dog from sliding forward. Signs of fatigue here are going to be if the dog steps off, if they can't hold their balance, that they're getting tired, they can't hold it. If standing on something unstable is too much, we can just start on flat land and see how that goes. This is a field trial lab that it took 6 months to fully get this dog back to training in the field before we were able to throw bumpers, all of that sort of stuff. And his program consisted of pulse shockwave, photobiomodulation. He would work out in the underwater treadmill 45 minutes for speeds varying between 4 and 8 miles an hour, lots of core work. And then this was his eccentric work here. So I did it in slow motion so you can really see how much of his core is working and what is happening here. The infinities are secured. When I watch it in slow motion, I think, oh my gosh, is he gonna slip? But we work with the harnesses on all the time with the dog. So if something does happen, we have them. But we really watch what's going on with his legs. I'm also always looking at the top line or their back. Are they able to hold a tight or a straight line? There is very important to look at. So really, he would do this for maybe up to 20 or 30 seconds. We would take a break, and this was part of his rehab program. And then functionally, we started with retrieves outside, so chasing bumpers, beginning with maybe 25 feet. I think the first time we did it was 10 times, and that was it. We took a break, we watched him for 48 hours, everything was good. Then we started to gradually improve until he was back out in the field. This is another way of using a roller or a pool noodle, something similar, and just slowly rotating here. And this is going to eccentrically work the lower abdominals as well as those hip flexors. You can see the dog picked up the left hind limb, so we're done. So I let the dogs dictate when they're done with things. So here, another form here. This dog was an obedience dog and suffered chronic iliopsoas issues, and this was his last visit. Just working on, I didn't want him to slide forward, so we're kind of holding him back, but I was also feeling for when he had had enough. And we're going to definitely watch for soreness. We're going to make sure he's, the dog is doing okay and not having any issues with that. Underwater treadmill. So I like to start these guys as soon as we can, even if it's just for 5 minutes with slow walking if they're in the subacute phase. The water is just below the greater trochanter, and then we build them up. And with the dog, this guy is preventative, but this is what I want to see, trotting at a nice clip, working nicely in there. And this is part of their multimodal approach. And as dogs start to improve, we're going to decrease some of their the modalities. We're really going to focus on what they need. The dog may only need joint mobilization, or they may only have a little bit of tightness, so I may use the piezo wave on them. Again, a CC loop positioning. If I can get it around the dog's leg, I love that. And it works great for owners too. For some reason, this really sticks with owners. So I always take photos of the positioning and text it or email it to the owner so they know where exactly we're doing it. And the same with the lumbar component as well. And so just to summarize, when we're treating the iliopsoas area, we want to make sure, again, we're identifying the lesion and the severity. Remember, in acute cases, we do not want to do stretching or range of motion. So we're going to hold off on that. We can start a little bit in the subacute phase, really letting the dog guide you. You cannot treat the lesion if it is not identified, and this goes for anything. So if you don't know why or what you're treating, then you need to take a step back and focus a little bit more on what is going on, or send them back to the referring DVM or to the look again. The multimodal approach, reducing pain and inflammation. And again, there's so many different ways that we could do that. Pick whatever is going to work best for you. My kind of formula that works great for these, I love my piezo wave I love manual therapy and I love the CC loop for home. That's the way that works best for me and the dogs that I'm working with to reduce that pain and inflammation, and certainly the pharmaceutical interventions. So I'm just talking about the rehab component. While we're doing that, we want to improve range of motion, improve strength, and improve function. So, and the function, every dog is going to be different. That yellow lab, his goal was to go back to full-blown field trialing. And that's different than, say, a 10-year-old lab that just wants to walk with their owner a couple times a week. And both of those are so important, but it's so important that you tailor the program to their needs. And as I mentioned earlier, the biggest mistake I see with these dogs is not strengthening the entire way. So making sure that you get them to whatever they need. That eccentric strength is going to be so necessary. And again, they're home exercise programs. So I send these guys home, the owners purchase in a CC loop. A lot of them like to go for the lounges because it's just so much easier for them. Passive range of motion, if the owners can. I always say some owners really struggle with that. The active range of motion, and then the strengthening. And then again, just some of your home exercise program, if they can perform the stretching, or just 4 limbs up, and that's sometimes easier for their active stretching. Then strengthening for home, hill work, core work, regular walking is always fantastic. So again, summary, you're going to look at what you need to do. This little guy was a show dog, and he had the endurance of like a turtle. He just was not used to doing so much. So he was always very tired. And I laughed when I asked the owner to just walk him a mile. And she said, I don't even think if he could do, a 1/10 of a mile. And, but we've built him up to the super dog. So this is my email. If you have any questions, deb@wizardofpaws.net. You can always reach out to me that way or find me on social media or anything like that.